Good evening, everybody. Hopefully, everybody is doing well. Just a really quick, short advice, or we can say a short information regarding how to make our image quality the best, or how we can make our image which can be more diagnostic, which the image can talk itself. So it's all about the ultrasound physics. So my personal opinion and my personal experiences, what I can tell, especially it depend which area of the body you are going to scan. That's all depend on that. So we have to do a few things. If we look which body part we are scanning, and regarding to that, we have to select the right probe, the right operating frequency for that area, and also we have to select the right application. If your application is not correct or if it's not the right application, then the image quality or the image resolution will be not the best. The better the image quality or image resolution, the best or the easy to reach to the diagnosis. So, for example, if I'm scanning thyroid tissue, for example, so for the thyroid tissue, I have to select linear probe, trying to use the higher the frequency, operating frequency. For example, if I can use 12 megahertz, that will be the best. I can use 7 megahertz too, but the higher the frequency, because this organ is so superficial and shallow, so no need for too much penetration. For that reason, I just need the best resolution. If I use instead of one focus, if I use three focuses, so that will be more informational. That will be more detailed image actually, and that will help me for doing diagnosis. So again, and also, for example, if I'm using maybe ovaries, or I'm using prostate in a male patient, so for that reason, I cannot use linear probe. Or maybe if I'm using curvilinear probe, I have to reach to the lower frequency. The operating frequency has to be the low level frequency I have to use, because we need more penetration in that area. The structure is too deep. So for that reason, I think it's very important to see which body area we're scanning, how that target tissue is deeper or shallow. So regardless for that, regarding that, we have to use the specific frequency of that one, the operating frequency. So that frequencies are very important for us. The probe selection is always important, but sometimes we can use different probes for, because maybe the right probe is not reaching to that area, or it's not working, or we cannot see image, we cannot see the target tissue. So on those reasons, or for that, in that situation, you can use different probe. For example, if we're supposed to be using the linear probe for DVT to rule out, or any arterial or venous studies, but maybe the person is a little more chubby or more muscular, and you cannot penetrate with that probe or with that frequencies the probe is come with. So in that case, you can use no problem curvilinear probe, because their frequency is lower frequency, which can penetrate better and can reach. So first of all, we have to use the right probe. But in case if the probe is cannot penetrate or cannot have a study with that one, we can use a different probe. Then that's a different story. But always select the right application, which make a lot of differences. Not only about the image quality or image resolution, also it helps if we want to do any of our measurements. So we want to use the Cal package, which has all the right information. Like, for example, if I use for the ovaries, and I want to know the measurements of them. Or if I'm looking for any of the kidney studies or prostate to know the volume of the prostate. So if I use the right application, it will give me, when we freeze the image and we do our measurements, it's better to use the Cal package, which already have all the information on them. If you use a different application, then you will not find those information. So this way, with the right application, we can use the Cal package, and it will give you all the information. Last few images will be your information or your results, will be all the measurements images. So which make it easier for you to read it, or if somebody else want to read your image and make your report finalized. Even if you're writing your preliminary report, sorry, even if you're writing your preliminary report, still that's easier for you, consuming. So that way, it's better to use the right application, right probe, and the correct operating frequencies. So I'm sure you will be fine with those kind of information, which will give you the best image quality, which image will be more diagnostic. So hopefully that will help you. I'm trying to upload some other information, especially regarding physics, which is the most important. I think ultrasound physics is really important. If we know ultrasound physics, I think that's we can diagnose image easily. So thanks a lot. And if there is anything I can help, let me know. Have a good night.